medical one, which are more solid, or like one of the good ones instead of the four flimsy ones that are kind of harder to reuse. The 60 cc wound irrigation syringe. I don't know why the 60 cc, because 20 cc would have been big, but sure, it's better than nothing, I guess. But you probably cannot, because the proper PSI would be on a 20 cc syringe with an 18 gauge. So 60 cc, you wouldn't have the proper PSI to do that. Ammonia inhalant, that I was very surprised to get. I mean, this has been out of kits since, I don't know, like, I don't remember the last time I had that. I think the last time I saw an ammonia inhalant kit was in what we call a cyanide kit, and those ones I think we stopped using in the last 5 years, 5 or 10 years. And before that, the ammonia inhalant was not that much of a use. So I don't know why there, especially in the video it says for waking up unconscious patient, is way better place, especially, and there was a lot of side effect, and that's why they stopped using it. So cotton balls, Q-tips, combos kind of stuff. Uh, Not quite sure. I hate cotton because like it gets stuck, especially if you use it in wounds and stuff like that. But I guess it would be pretty good for some stuff, but I'm not quite sure the purpose of that one over there. Again, sterile dressing, multi-trauma. There's the scalpel. That's a good thing. Manifold glass. So there's a few good instruments. I like that. Thermometer. They didn't specify what kind of thermometer it is. I like the disposable one because they're smaller and you can carry a little bit more. So then you don't have to clean all the thermometers and stuff like that. The dental kit is very nice. It's very well done. I really like that. Betadine swabs, sticks, again, not a big fan of those. There's sterile large glove. There's two pairs. So they say large gloves. So right there, a lot of people probably medium would be better, because now if you have small hands, it would be very hard, or it will be very hard to fit in them. A large hand would probably fit in this in the medium, because they would be tight. The medium obviously can fit in the medium, and the small would feel a little bit loose, but not that much, or the medium. So if you're gonna put one size fit all, it would be better to put like the medium size. But two pairs of sterile gloves. One could have been in. I'm not quite sure the reason of the sterile glove here, because suturing has been proven to. In the 80s, they did some studies that people, even like with just their hands, they wouldn't need to, as long as they're wash your hands, you don't need gloves or sterile procedure or anything to do that. So, and in wilderness medicine, they talk about that stuff. If you're gonna do a suture over there, anyway, the environment's not all sterile, so it's not that much necessary to have a sterile gloves. Unless you're gonna do inside stuff. So like if you would do like a gynecologist exam or a vaginal exam, sorry, then that would be probably your. So if you're going inside the body, but if you're suturing, it's more the needle that's going inside. That needs to be sterile, obviously. But the glove outside, you're not really touching because you're using instruments. So iPads. And then the whole medication, kind of very happy with that, like I was saying. Ace bandages, again, that's a little bit extra space for something that is could have been replaced by other stuff. Moleskin, I'm not a big fan of moleskin. I find that when I ever used it, it moved all me. So I prefer, there's other stuff out there now, a lot of new dressing, especially for preventing pressure, and it looks a little bit like a Band-Aid actually, but it's two layers of stuff, so it's very nice. Very compact, easy to put, and you put it on your. And there's even some that you put over your socks so they decrease, and some that you put on your red spots. As soon as the red spot, you put it on. Chalk pad. I really like that idea to have like something so you can make like a little place in the hoster location. Hand sanitizer. There's a 5 N95 mask. That's not bad. 10 surgical. I would put way more than that. I read even an article one time that they said for real endemic and stuff, you would need about 100 of them per person. So the surgical loops, and in the video, they kind of don't quite agree with the way they say it, that you would need to put an N95. So N95 is to filter the air. But if it's droplets and the person is wearing a mask, those droplets are not going anywhere. So so if the person is wearing the mask, then it's better the other way around. The problem though with those masks is in the hospital protocols, if they cannot have the mask more than 20 minutes. So every 20 minutes you have to change those masks because when they get wet, they kind of change on that. So yeah, blood pressure, cuff, and stethoscope. Sure, but know my philosophy on that. It's hard to maintain. It's heavy to have in the bag, and as well as that you have to once in a while calibrate it. They're easy to break up, and I didn't see the quality of it. But a stethoscope, if you don't have a very good quality of them, and most of the time when they come in those kits, they're not good quality. It's almost worth not to have it, or even buy a Fisher Price one, because like the quality of what you're hearing is not there. So usually I would rather have like a stethoscope. I mean, you don't really need it. Like I said in the past, if you're able to feel the pulse and stuff, there's other things that you'll see, and if you'll be able to concentrate on other stuff. But that's for another rant that I already did. Not much for fracture. I was surprised there's only one SAM splint, and there's not much. I find like for ortho, there's not that much over here, which it could be a little bit more. I mean, the fracture could be pretty. And the Sam Splint one are not that comfortable. The ones I bought some new ones from the same company, about the same price. They're a little bit more expensive, but they're way more comfortable. They're a little bit more absorbent, and they can last longer. And they also can you can flip them around and things. So they're way more than the Sam Splint padded one. So I would rather have this, and I would have at least two, so that if you had, because now if you have a leg, there's not much you can do unless you put the legs together. But then you're getting other issues like, I mean, if I have a broken leg, then you need to if I put two of my legs together, then the person cannot move, and all that stuff. Also they were talking about using of talking about ortho. I mean, we're talking about severe bleedings and infections and stuff. And I know in their books they talk about amputation. Well, I don't see anything here for amputation. It would have been easy to put like a little kit together, even just one of those saws. So for ortho, I find the kit is a little bit low. Doesn't have that much. Also, for hydration, there's only two hydration powder. I guess you can always remix it, but I don't see really anything to mix them with. Yeah, it would have been nice that they put a little bit more to it, and especially now you rehydrate the person, it's nice, but you need to feed them, especially if it's a kit. Again, like I was saying, it's hard to say like what kind of kit is it. Is it for a bug out situation? And if it's a bug out situation, you need to put also things so that you can replenish, because a lot of things people say, oh, give them the pills for stopping their diarrhea so then they won't be dehydrated. But actually that would be a bad strategy, because the reason your body is having all this diarrhea is that there's a infection most of the time inside your body, and then if you keep it inside, it will just get worse and worse and worse, and then it can get to your bloodstream. So you need to get rid of that stuff, and you need to flush it out again. But then if you flush it too much, then you get dehydrated. So it's kind of a vicious circle, but you need to play with it a little bit with all that. And obviously and also the Gatorade G2 rehydration powder is not that great. Gatorade usually is too concentrated in sugar, so that's why oral rehydration kit usually are better mix than the Gatorade. The Gatorade ones are not that great because of that. There's other stuff that is much better and way more appropriate for medical purpose than Gatorade. Organic teas, that's a nice little thing. Honey, I was very happy to see that, and not that much surprise in a certain way because it's a thing. And some lip balms. There's also some cold pack. Sorry, I find the problem with cold packs in bags like this. As soon as your bag either get crushed or something, your cold pack gets activated. So I would get rid of the disposable one and keep those reusable one. I like that idea of having the cold pack and hot pack reusable. Um, and the food cream, that was a nice touch. The bug bite stuff, petroleum belly, and jelly and stuff. So that's the review of the kit. It's pretty complete, but again, like I was talking about, for the price and the weight of it, I find it's too big. There's a lot of stuff that they could cut on and decrease first the price and the bulkiness of, because I mean it's a bag. You need to carry the whole bag with you. So if you have other stuff to carry, that's a little bit stuff. And I don't know if then a backpack is the best way as well. Maybe even I don't know exactly all the side, but maybe even aside those rib things would be maybe even a better solution. So that way you can have, because most people will carry a bug out bag to get out or stay in. So to have that in, then if you have a bug out bag, so what do I do with the medical bag? So somebody else will carry that. So you have one bug out bag and stuff. So in that format, maybe something else would be a little better. So anyway, that was my review, and I'll talk to you soon.